I'm Dr. Benjamin Levy. I'm an associate professor at Johns Hopkins School of Medicine and the clinical director for the Johns Hopkins Sidney Kimmel Cancer Center at Sibley Memorial Hospital in Washington, D.C. Mucoepidermoid carcinomas of the trachea are extremely rare tumors. And if we look at just the general classification of head and neck tumors, the most common obviously is squamous cell carcinomas. Then we've got adenoid cystic carcinomas. And then we have these low grade tumors like mucoepidermoid carcinomas. So these are rare tumors that we see. Most of the time, surgery is the optimal treatment for head and neck tumors, even for squamous cell. But for these mucoepidermoid carcinomas that tend to be low grade, once surgical resection is done, there's just not a lot of data to give any sort of consolidation or adjuvant, either radiation or chemotherapy respectively. I think in rare circumstances, we would follow the pattern of a potential squamous cell cancer. If you had a positive margin or extracapsular spread, then there could be a consideration for chemotherapy. But for the most part, number one, mucoepidermoid carcinomas of the trachea are extremely rare. Number two, they tend to be more indolent, not benign, but less aggressive. And number three, surgery generally is the approach. Not a lot of data for any adjuvant chemotherapy or radiation. So for this patient with a low-grade mucoepidermoid carcinoma of the trachea that's resected with positive margins and is otherwise doing well, I would not offer any sort of systemic treatment. I would follow these patients with surveillance, but I don't think we have any great data on how to manage the perioperative systemic regimens for these very rare tumors of the trachea.